Welcome to week 34 of the Kid and Parent Pregnancy Show. I'm Asha. You are eagerly waiting for your baby to come into the world. In today's show, we will try to understand stages of labor. We will also explore how to differentiate between false and true labor. Changes taking place in mother. If you are expecting for the first time, you may feel dropping at this stage. The process of the baby's head entering the birth canal is called dropping. Mothers with previous deliveries may feel this movement before the labor. Once the baby's head enters the birth canal, you find it easy to take deep breaths. The pressure on the diaphragm is released when the baby moves towards the pelvis. You may feel some pressure in the vagina after the baby drops. Antibodies pass from your body to your baby and strengthens his immune system. When you breastfeed your baby after birth, he is provided with more antibodies. Tip of the week. Make a list of things to be done, important numbers, your medical papers, list of things to be taken to the hospital, ready by now. This comes handy in case of preterm labor. How is baby doing? The brain and nervous system of your baby's brain are fully developed. Fat keeps adding on to his bones. His bones continue hardening due to the calcium intake from the mother, but the bones in his skull are still soft and separated. This makes it easier for the baby to travel through the birth canal. His head begins to move into the pelvis during this week to position himself for delivery. He keeps his eyes open when he is awake. The lanugo hair is almost completely shed off. After this week, the only significant change in the baby is his weight gain. Stages of labor. Childbirth is a unique adventure. Each delivery is unique and follows its own path. Childbirth is divided into 3 stages: labor, delivery of baby, and delivery of placenta. We will take a look at what happens in each stage. Stage 1. Labor. Labor is divided into 3 phases: latent or early labor. This is usually the longest of the 3 phases. It lasts for about 8 to 14 hours. It is also the least intense and least painful. The cervix starts becoming thinner and is dilated to 3 centimeters. As the cervix opens because of the thinning, it moves forward. Initially, it is firm, and by the end of stage 1, it is soft and stretchy. Active labor. This is usually the longest of the 3 phases. It lasts for about 2 to 3 hours on an average. The cervix is dilated to 7 centimeters. The contractions are stronger, longer, and more frequent. Advanced active or transitional labor. This is the final phase of stage 1 of childbirth. It lasts for about 15 minutes to an hour on an average. The cervix is dilated to the maximum to a full of 10 centimeters. The contractions are very intense. Stage 2. Delivery of baby. The entire process takes about half an hour to 2 hours. If this is your first baby, this stage may last a few hours. If not, it may take only about 10 minutes. The contractions are more regular and usually less painful than the transitional phase. Your womb pushes your baby down the vagina or birth canal. Stage 3. Delivery of placenta. Your baby has come out and it is now the turn of the placenta to be delivered. The entire process takes about 5 minutes to half an hour. You will experience mild contractions within a few minutes after the baby is born. The contractions detach the placenta from the uterine wall into the bottom of your womb. You can then push it out of the vagina. This results in the delivery of the placenta. False and true labor. All pregnant women at some point wonder how will they know if they are in labor. Here are a few things which can guide you. Timings of contractions. False labor contractions are irregular, but real contractions come at regular intervals. Change with movement. False labor contractions stop with change in position, but the real labor contractions do not stop. Strength of contractions. False labor contractions are generally weak. They go on increasing in real labor. Pain. During false labor, pain is felt in front mostly, but upon real labor, pain starts at back and moves to front. Did you know? One in 250 pregnancies can result in identical twins. Have a nice week with this lovely thought by Carrie Fisher. Everything grows rounder and wider and weirder, and I sit here in the middle of it all and wonder who in the world you will turn out to be.